Hi, I'm Dr. Dean Peppard, and I'd like to thank you for taking a moment to watch this brief video. In this video, we're going to talk about neck exercises. The neck exercises I'm going to be introducing today are ones that I commonly give as a home protocol for my patients to do when they're coming in with a neck issue. These neck exercises can be very effective, and I say that having had issues with my own neck and using these exercises with great success. I want to explain that they're very, very similar to the McKenzie exercises. For those of you who are familiar with the late physical therapist Robin McKenzie, he developed the exercises that are basically the ones that I'm going to show you, but mine are just a little different. I have just a little bit of a twist on them. So I'm going to go through the three most common exercises that I'd like to recommend as a home care type of a program for my patients. The first exercise I'm going to demonstrate is called the neck retraction exercise. And this exercise alone is probably the single most powerful out of the three that I'm going to show you. The retraction exercise is just what it seems like. It's a retraction movement for your head and your neck. I'm going to go ahead and pivot 90 degrees so that you'll get a better appreciation for what this exercise looks like. And I'll continue seeing if we can talk our way through this as we go. So for the retraction exercise, generally, you want to have your body in a neutral position. You're going to take your hands and place one on top of the other. And for the exercise, you're going to actually move your head and neck forward with your neck muscles. And you're going to use your hands to bring the head and neck back. So this is what it would look like if I was going to use my head and neck muscles to go forward. And then if I'm going to use my head and neck muscles to go back, it looks like this. But instead of going back with my neck muscles, I'm going to use my hands. So this is what the exercise would look like. I'm forward with my head and neck muscles, backward with my hands, and now my neck is not contracting any muscles. So this would be the rate that I want to do it at. Typically, when I recommend that exercise, I ask the patient to do maybe like 10 repetitions or 15, and they're going to be doing that quite frequently. If their neck is really in a lot of pain, I might recommend that they'll do that every hour. Most people who are not having too bad of a problem can do that exercise maybe every couple of hours or 3 sets a day. The next exercise I'm going to show you is an extension exercise. So this exercise will have the head and neck going backwards, and it's going to be all active here using all of our neck muscles. The way that you do this exercise, you're going to be sitting in a neutral position, and you're going to gradually put the head and neck backwards as you rotate it. So this is what it looks like. Gradually, we're going to go from a neutral position. We're going to put the head and neck back. Now we're going to turn a little bit to the right. Now we're going to go back a little bit. We're going to turn to the left. And we're going to go back again. And now we're going to rotate all the way to the right as far as we can go. We're all the way back. And now we're going to go all the way to the left side until we're finally at the end. So that's what the extension exercise looks. So in that type of an exercise, generally we only have the patient do anywhere from 5 to 10 of those, and that would be the second exercise that I would have patients do once they get to the point that it is not a painful activity for them to be doing. The third exercise I like to recommend is for those patients who tell me that they have radiation of not only neck pain, but it goes now into the base of the shoulder or it starts going down the arm. In that instance, what's happening is when I've diagnosed them properly and told them that they have a problem in their neck causing this radiation into the arm, now we give them an exercise to help this area function better. So we still do the chiropractic adjustment, but now at home they're going to be doing an exercise in an effort to help this signal become better. So now, in addition to doing the adjustment at home, we're going to be showing them an exercise which will help them normalize the alignment and help this signal flow better. So this is what it looks like. We're going to have the patient sit as best they can in a neutral upright position. You're going to put the head and neck back, and you're going to take your involved side and you're going to be putting it on your head, and you're going to pull that head and neck to that involved side. And then you're going to go back to the midline. And then you're going to go to the side, and then back to the midline, and sideways, and back to the midline. It's important to note, when that exercise is done, we only want to do the involved side. If the patient is having no symptoms over here, we do not want them to do the left side. We're only going to do the involved side. Well, there you have it. Those are the 3 exercises that I like to recommend. And not every neck patient that I see is going to get all 3 of them. Depending on their presentation and what they need, I'm going to tailor the exercise protocol to exactly what they need. But those are 3 exercises that are very helpful in helping patients help themselves recover a lot faster. Well, I thank you again for watching the video, and we'll look forward to seeing you next time.